Is it worth it to try chiropractic first if I'm told that I need surgery? Hey folks, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas, and I'm a chiropractic orthopedic specialist and winner of Amarillo's Best Chiropractor 2020. And I'm coming to you again this week with a lot of information on you being able to avoid surgery. I want to make an effective argument here on why you should give chiropractic a try before you ever consider surgery for certain issues. This is one you're probably going to want to share with your family and your friends, so do me a favor. I think this is vital here, folks. Do me a favor and make sure that you help us spread this information around. If it's not relevant to you personally right now, it may be eventually, and I promise you this, somebody on your friends list needs to hear this information immediately, right now, today. So your help is appreciated greatly. There are so many directions this information could go in, so let us just break it down step by step. This is definitely an educate yourself kind of video. I think the most important thing to say from the top here is that I am not a chiropractor that is against surgery for the right person, the right condition. And I'm not one that is against the medical profession at all. A family member of mine is a physical therapist. I work with the medical profession. Some of my patients are medical doctors. Some of my friends are surgeons. Many more of my friends and collaborators are nurse practitioners, physician's assistants, RNs, LVNs, and we even currently have a CNA working with us here in my clinic. And you might say that I'm part of a team, basically, because honestly, when practitioners of all kinds are working together as a team, well, the winner every time is the patient. There's no doubt about that fact. I wanted to get that out of the way because some of the things I say here in this video could be misconstrued as maybe me being against surgery or against the medical profession, and that's simply not the truth. I am against surgery and shots when taken out of the proper order in treatment recommendations and guidelines, and I'm against shots and surgery for the wrong patients and the wrong conditions. And I think that that is fair, and I think it's sensible. At least that's my opinion and my view. Now that we've covered all of that, a good place to begin is with the more recent recommendations by one of the very largest medical groups in America, which is the American College of Physicians. In a guideline written by Qasim in the Annals of Internal Medicine, the ACP, American College of Physicians, now recommends the following be tried first for back pain of any duration, long-term and short-term pain. So spinal manipulative therapy, which is also chiropractic, massage, exercise, acupuncture, low-level laser, cognitive behavioral therapy, yoga, but not all kinds are perfect, so ask us first, and then Tai Chi. And here at our clinic, we offer the first 5 of those that I listed, all here, right here in one spot. So thanks to this paper, we can now say that if you go to your doctor, whether it's in the emergency room, whether it's a family practice setting, or in a surgeon's office, and they are not looking at these techniques as the first-line therapies to be tried, then they are technically out of current thinking, current research, and current guidelines. They're outside of those things. And you must view it in this way. It's vital to see things this way because if you don't, you are at risk of having an outdated doctor sending you down the path of unnecessary medications, unnecessary treatment like risky shots and potentially even surgery. Who wants that? Now that sounds dramatic, but a project from 2012 by Keeney et al. Demonstrated how hurt workers, injured workers that visited a surgeon first had surgery 42.7% of the time, while hurt workers that went to the chiropractor first only had surgery 1.5% of the time. 1.5 versus 42.7%. And we're talking about surgery, y'all. That's a big difference. And the fact is, if you go to a surgeon, many times you're going to get surgery. When you have a hammer, a big hammer, most things kind of look like a nail, don't you think? It's not just the ACP saying these things either. This same sentiment is echoed by the White House Commission on Opioid Abuse, the Lancet series on low back pain, which was done in 2018, the Joint Commission, which was done in 2014, and to an extent, even the Journal of the American Medical Association in 2017. So being able to advocate for yourself simply comes down to just being educated as a patient. It's as much the patient's responsibility as it is the doctor's. In 2020, with Google.com and all that good stuff, you can find these issues and these answers. Following the failure of all of the techniques that I mentioned, if all of those fail, according to the ACP, a patient would then try low-grade medications. If they failed that, then higher-grade, riskier medications. Assuming all of that failed, all of it failed to resolve the issue, then and only then would shots and potentially surgery ever be considered. We have an unfortunate culture these days where the table is flipped 180 degrees and surgery and shots are happening before going through the treatments in the correct order. This thinking has to stop immediately because patients are getting permanently altered surgically when the ladder is upside down, and that is simply unacceptable. More recently, in 2020, a project was published in American Family Physician about chronic pain and the need for non-pharmacologic and non-invasive treatments. This project reiterated and backed up the recommendations made by the ACP, saying that yes, spinal manipulative therapy, massage, exercise, acupuncture, and low-level laser provide relief for chronic pain. They even help in cases of fibromyalgia, and they say that patients should be undergoing a multimodal, meaning several types of therapies, a multimodal treatment schedule to get over this chronic pain. That's exactly what we offer, and that's exactly what a lot of evidence-based, patient-centered chiropractors offer. Now that I've demonstrated the fact that medical entities recommend alternative therapies be tried before surgery, well, let's talk about the surgeries themselves, shall we? Most are not aware of the fact that a lumbar spinal fusion or low back spinal fusion surgery costs about $60,000 for Medicare and up to $150,000 for regular insurance-paying patients. And I think we can agree on the fact that this is incredibly lucrative. But most don't understand that the most common surgeries done for musculoskeletal conditions like this, they're not backed by good research when you really boil it down. Let me explain. A paper from just this year, 2020, it searched the research database to perform a systematic review. Now, a systematic review is at the very top of solid, well-backed research. And they took 6,735 studies. That's a lot, almost 7,000 studies having to do with the most common musculoskeletal surgeries out there that are being performed every day. Of these 6,735 studies, only about 1% of them, 64 studies to be exact, only about 1% of them compared having the surgery to having no surgery at all. Here's the eye-opener though. Of those 64 that actually compared surgery versus no surgery, only 9 studies actually favored having the surgery. Wow! Only 9 papers were actually favorable to having surgery. Another very common surgery is shoulder surgery. I wonder what the number is for patients having surgery on a torn rotator cuff muscle in the shoulder. I wonder what that number would be when recent research has shown us that 75% of full thickness supraspinatus tears, part of the rotator cuff, can be rehabilitated successfully without surgery. I just wonder what the number is. And on top of that, epidural steroid injections, y'all, they come with their own sets of dangers and risks. They've been shown to not be very effective at all, and they're super expensive. And when they actually do help, the relief is short-term only, and they can provide absolutely zero help in the long term, and they change nothing as far as whether somebody ends up getting disabled or having surgery. It's basically like taking the batteries out of your smoke alarm during the fire because, well, you don't really like the noise it's making. Besides, these shots can also put the integrity of your bones at risk. They don't make sense, but they're wildly popular now. As I've demonstrated, not only do the largest organizations in the medical industry recommend alternative therapies for back pain first, but now you understand the lack of research backing these incredibly invasive and risky shots and surgeries, many of which are repeated several times, trying to achieve some sort of effectiveness. So why are the medical professionals, why aren't they consistently filling up offices like mine with musculoskeletal patients then? Though the relationship is exponentially better in 2020, the history of fighting between the chiropractic and the medical profession, it's a long history. Those in control of both professions, they've got long memories as well. And with that being said, there have been significant inroads made in integrating and in collaborating and in becoming more of a team with the patient's best interest at hand. It is getting better every year, and the opioid crisis has really picked up the speed on the process. It's been like a snowball rolling downhill, as a matter of fact, considering that doctors of chiropractic can play such an integral role in helping patients reduce and ultimately eliminate pain medication when they're made a part of the team and actually made part of the process. And research backs this up. Some of the reasons medical professionals are slow to refer to chiropractors at this time is that there's still a bit of mistrust in the chiropractic profession, and the chiropractic profession is not well standardized. Yes, if I'm being honest, again, the profession is just not very well standardized, and it is hard for a medical professional to know exactly what kind of chiropractor that they would be sending their patients to. And at the end of the day, well, nobody wants to look like a fool for sending their patients to somebody that's not really on top of their game. Also, many medical professionals they don't know much about evidence-based, patient-centered chiropractic care like you can find at my clinic. They don't know the research, and many times, well, they're just too busy to go find it themselves. They got a lot of big fish to fry. So this is frustrating for practitioners like me, but it's also understandable. So it's my job to continually try to educate. To the original point of if one should try chiropractic before surgery, well, my answer would be that every condition is different. So no firm declarations can be made here in a social media video. But in general, for non-complicated neuromusculoskeletal pain, according to the medical field's leading guidelines and leading thinkers, and considering the incredible risk and lack of evidence behind the most common shots and surgical procedures, well, I think one would be crazy to recommend shots and surgery first before doing what research tells us all to do, which is visit a clinic, as we have right here in Amarillo, Texas, where you're going to find chiropractic that is evidence-based and patient-centered. You'll find massage, exercise, acupuncture, low-level laser, balance and proprioceptive training, and much, much more, all geared to get patients back on their feet non-invasively, non-pharmacologically, safely and smartly, based on research and based on guidelines from the medical profession, not the chiropractic profession. Now that's what we call evidence-based, patient-centered care. You should try it. I hope I've answered any questions you have here. We really can help people avoid surgery. If you are watching this video on YouTube, please hit the subscribe button so you don't miss any more of these extremely important videos. If you're watching on Facebook, like I said from the beginning, a like and a share would be integral to saving one of your friends or one of your family members from surgery that may not even be necessary. If you're from the Amarillo area or you're going to be passing through and you need our help, pick up that phone, call us at 806-355-3000 and set yourself up an appointment with us. It's fast and it's easy to do, so get that done right now. Again, I'm Dr. Jeff Williams with Creekstone Integrated Care right here in Amarillo, Texas. Until next week, stay smart, stay safe, and we'll see you then.